Do you have pain constantly in your knee? And do you think weight has anything to do with it? Hi, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India. And welcome to another video where we're going to be talking about the effect of weight on your knees and how does it cause pain. So weight is very simple. Your knees are made to take a particular load, right? So if you are X number of feet tall, your knees are a particular size and their ability or they are made to take a load of a particular level. However, if that load is more, what's going to happen? There's going to be more stress on it. So when you gain weight, there's excessive load on the knee. So it's been said that for every 1 kilogram of weight you gain, 4 times that goes through the knee. So imagine you gain 10 kilos, it's like 40 kgs going into your knee extra. So when it goes that much, what happens is there's a lot of load on the knee. Initially the knee is not happy, so it cries, it swells up and it causes you pain. Later on what happens is as the load keeps progressing, remember your knee joint is made up of 3 bones, the thigh bone, the leg bone and the kneecap. All 3 bones are covered by cartilage, which is a polish. So when there's a lot of load on the cartilage starts getting worn out, there's friction, there's swelling and there's pain. This leads to early arthritis in your knee. So weight gain is a direct correlation with arthritis development and can cause pain in your knee. Apart from that, people who are on the heavier side usually have weaker muscles because they've gained weight because they're not exercising regularly. Because the muscles have been made to support the knee. So when God gives you one part, He gives you another part to support it. So the best friend of your knee joint are your thigh muscles and your hip muscles. So if your thigh and hip muscles are not strong, there's a lot of load that gets transferred directly onto your knee, which can cause pain and swelling. Apart from that, the structures that attach the muscles to the bone, which are tendons and ligaments, also to support the knee and to give you balance, are under more pressure when the weight is more. So when they are under more pressure, the ends where they attach onto the bones are affected more, there's more load to it. For example, it's like a clothesline. So if you pull a clothesline, the maximum load is where the clothesline is attached to the wall. Same way these tendons and ligaments can get sore, causing tendinitis and pain. Apart from that, if you're on the heavier side, you kneel down and do things like that, load on the bones increases, load on the cushions on the bony prominences called bursae increases, they can get swollen up, cause bursitis, and that can cause a pain. So what are the symptoms? Symptoms are classically pain that's gradually increasing. If you're noticing, if you feel you've been putting on weight when you see yourself on the scales, x-ray wise nothing is being seen, beware, it may be the beginning. So if a stitch in time saves 9, if you look after your weight, maybe the progression of your pain can be arrested. So what can you do? Stay healthy, eat healthy foods like turmeric, blueberries, almonds, walnuts, omega-3 fatty acids, cod liver oil have anti-inflammatory properties. They can help in delaying degeneration of your knee. Exercise regularly, strengthen your thigh muscles, your hip muscles, make it a routine. Walk, swim, cycle, these are great. Avoid impact activities like jumping, the trampoline, skipping, etc. If you're on the heavier side, till the time you lose weight. Eat healthy, sleep healthy, think healthy, exercise regularly. That should be your mantra. I hope you enjoyed this video. If you like my video, please like and subscribe to my channel and please follow me on Instagram. For those who like Hindi content, we have a very popular Hindi channel, which is a silver play button winner. Please like, subscribe and follow it. Thank you very much. Namaste.